Hey guys, it's Dr. Sandy, and I wanted to take a few minutes to talk about the holistic crisis prevention system. We are going to have a program called the Behavior Prevention Program. Now, this is a trademark program that is taking all of the different areas and all the different programs that are already out there and recommendations and creating something for healthcare workers by healthcare workers. A lot of the systems that are out there are built from third parties, and they are not encompassing the things that we need also as a profession. So I wanted to tell you and show you a little bit about what goes into this program, and this is only just a little bit. I was able to compile some of the peer review articles and stuff that I've used in my DMP project that I'm going to be incorporating into this huge project that we have coming up. Also, I have the trademarked curriculum frameworks that are already made, and it's called Preventing Patient Nurse Abuse Education, the curriculum framework. It is all copywritten, and this is to help with educators to be able to talk about what needs to be addressed in the mental health education. It's not just about mental health, it's about addiction, it's about relationships, and it's about building upon something that's not there in our system at all. It's, as we know as healthcare workers, it has become a huge corporate entity where nurses and frontline healthcare workers we're so eager to give and to take care of our patients, we're not able to take care of ourselves. And it incorporates different areas where it's not only for self-care, but it's also to help prevent things before they even get to the point of de-escalation. And we will break down all of the different comparisons of why our program is more effective than it would be taking somebody, meeting them in the middle with de-escalation according to the vocabulary definition, and stopping this person when they're already in mass hysteria. Well, what happens to the person? They get re-traumatized outside of everything else that's been happening in their own life. The nurse, the healthcare worker that is de-escalating this patient, they are suffering a form of trauma, as well as also the people that are involved indirectly with this patient. If this patient was suffering with mania or something like of that nature, the unit might be distressed. So how do we go and we fix that? So how about we prevent problems before they get to the level of de-escalation? So when I talk about this, and I talk a lot about this in Nurses Against Violence, where we're not about being against any healthcare organization, we're all about making it better. And for all of those out there that are like, yeah, Nurses Against Violence, yeah, we are Nurses Against Violence, and we don't want the violence. And that is why we have such a huge group right now. And we're just building and building and building because we're eliminating that violence in healthcare. So I wanted to give you another shot. This is just a few of the things that I've put into the curriculum frameworks. And I'm going to be building the program here momentarily. I have the program up and I'm getting ready to upload some stuff. And if you are interested in being one of the first individuals to get a certificate, I'm going to be running a contest. And it's going to be very soon. I just need to get the first level out of the way, and everything else is going to become fluid. I already have all of the information. We have lots of organizations that are trying to get our information, and that's fine because now it's trademarked. They have to go through me and get permission before they could even use this material. Also, if you have a school that has a mental health program that would like to supplement with what we have available, we will have a special price for that to help nursing schools, because I know that they're suffering as far as like financially, and it is going to be nothing but a benefit to both nursing schools, healthcare organizations, and just literally changing the face of healthcare. This isn't all about mental health. This is, well, a lot of it does, but it's also about being in tuned and having relationships with people that you work with. Also with upper management and the folks that are working on the floor, build that relationship. So This program is for everybody, not just frontline healthcare workers. This is also for teachers. This is for everybody that wants to know how to take care of people and also indirectly also take care of themselves in the process. So if you're interested, I would like to see you write something in the notes. If you feel like your class or your college or your where you work would benefit for something like this, reach out to me personally. Let me know in the comments if you would like to be one of the first folks that are going to test run this program. And I look forward to talking with you. And welcome to Nurses Against Violence Unite. And introducing our new program is called the Holistic Crisis Prevention System. And we're going to have different education products in there that are going to help you grow as not only a person, but also a healthcare provider, and also to help give back. We love our profession. I love our profession, and this is our time. So welcome. Thank you very much for listening. Again, look at all that stuff. There's more to it. So I look forward to seeing you. Bye.